Iowa Governor Kim Reynolds signed a bill into law Thursday that bans school officials and local jurisdictions from requiring face masks. According to the measure, cities and counties will not be allowed to implement mask mandates for businesses. The governor called the move a win for individual freedom. But Iowa's not the only state to issue such a mandate. Earlier this week, Texas Governor Greg Abbott passed a similar measure prohibiting government entities, including public schools, from requiring face coverings. For more on this, I want to bring in Dr. Owais Durrani. He is an emergency medicine physician at the University of Texas Health Science Center at San Antonio and also a member of the Committee to Protect Healthcare. Dr. Durrani, what do you make of this decision from these states to prohibit mask mandates for businesses and schools? And can individual businesses in these areas, if they're not run by the government, are they still able to have mask mandates if they'd like?
Thanks for having me. In one short word, I would say it's reckless. I think back to a year ago when my colleagues and myself were in the emergency department and we were seeing COVID patients day after day, patient after patient. And the one thing that kept most of us safe was a mask. And so it's a tool that needs to be in our arsenal kind of moving forward. Texas was the first state to end stay-at-home orders. We were the first state to end mask mandates. And now this move comes. Honestly, I'm not surprised, but I'm very disappointed because it's something we really need moving forward.
And millions of children between the ages of 12 to 15 are eligible for COVID-19 vaccinations, but younger kids aren't. So how could a decision to ban mask mandates actually impact children?
Yeah, it's going to lead to a huge negative impact. So, for example, in Texas, even though our metrics are headed in the correct direction, we're still amongst the top 10 states when it comes to the number of infections, hospitalizations, and deaths. On the flip side of things, we are about 33% of adults fully vaccinated versus a national number of around 38%. So we're lagging behind in that area. So that combination of things makes us in a very volatile state. As you mentioned, kids under 12, there's no vaccine approved for them. And even those above 12, we're just barely getting started on vaccinations. With summer school and then school in the fall coming up, schools and even universities need this tool in case they have outbreaks, which I imagine will happen at different places in Texas.
Last week, the CDC lifted almost all masking and distancing recommendations for fully vaccinated Americans. But that's also created a bit of confusion. What's your take?
Yeah, so I think what the CDC saw was hundreds of millions of people who got vaccinated, looked at the data, and saw that those who were vaccinated were at a very low risk of getting infected and were at a very low risk of passing that virus to others. And so based on that, they made the correct decision. The problem becomes in our country and worldwide is that there are a certain subset of the population that doesn't want to wear a mask. A lot of those individuals also don't want to get vaccinated. So that combination kind of leads to an issue for all of us because we all live in one country, one community, and what happens in one area affects others. And so I think this is going to be an interesting experiment in biological sciences and behavioral sciences and kind of figuring out a way how we move forward. I think, I was watching the NBA playing games yesterday, and they were able to expand capacity because they had a vaccinated-only section. I think we're going to kind of move towards that where there's going to be certain subsets of the country that are going to be able to partake in activities because they're vaccinated and they did the responsible thing. And there's going to be other parts that just won't be able to kind of partake in the things that they've missed out on for a good part of over a year now.
All right. Dr. Owais Durrani, thank you for joining us and thank you for all that you do.
Thank you.